Okay, I want to move into something a little more noteworthy in the world of medicine because people get a lot of tattoos as a form of art. Sometimes people get it to commemorate their loved ones. But what if I said you could receive a life-saving medication from a temporary tattoo? What's this all about? Researchers at Baylor and Rice University say this could be the future delivery of medicine. So what this technique is, it uses these things called nanoparticles. They're placed just under the skin, and the carbon-based particles form this little dark spot that does fade over a week or so. But those nanoparticles actually contain treatment, and it's then slowly released over a week or so into the circulation, which is a much better method of delivery than all-at-once injections or having to constantly take medication. And in autoimmune diseases like MS, they've done research on this, and these are the types of medicines that will say stop your T cells back in your own healthy tissue, like in autoimmune illnesses. I love this concept.
So it starts with a dark dot, and then you can go anywhere you want, taking that dot to a temporary tat.
What's really interesting about this is that they modify the nanoparticles so that they actually target the immune cells. So it's more focused therapy, because we know sometimes when you're targeting the immune system, you can target too much. You can get to, and so there's a lot of side effects to some of these immune modulating medications. So this is an early study, but it's very, very exciting to me.
I agree.
And we know there's so many disease processes. We're finding a new one every day that are immune based. So
this is not only an interesting way of fighting off illness, it's an interesting delivery method with these, well, we're calling them temporary tattoos. That's not what they're going to be called in the world of medicine. But I think when you're starting to especially talk about younger patients, you know, temporary tattoo, kids love temporary tattoos. Heck, adults do.
Yeah, no, I do. I had a great one that was an EKG strip on my arm. I felt like the coolest mom at school. Like, it's fun, yeah.
Live on the edge, crazy and wild.
Born to be wild.
Born to be wild. Well, speaking of